Ovarian and prostate cancer are deadly diseases, killing tens of thousands a year, and doctors hope spreading the message of early detection, when possible, can save lives.
That if we detect a tumor in early stage and we treat it, it never come back.
Dr. Gilmore is an ovarian cancer researcher at Yale University. One of the hardest cancers to detect early, ovarian cancer strikes some 22,000 people a year, and about 16,000 die from the disease. Once symptoms appear, the disease has usually reached an advanced stage.
We need to come with this new concept. Ovarian cancer is not what we thought for more than 100 years.
Dr. Moore says current screening isn't beneficial for most women. His groundbreaking research is discovering the cancer may actually start outside the ovaries. Knowing this will change how we screen.
The treatment for ovarian cancer in the future will be a combination of drugs that include chemotherapy that is killing the bulk of the tumor, but also specific treatments that will kill the generals, the mother cells, what we call the chemo-resistant cells.
Another silent killer is prostate cancer, affecting over 200,000 men in the U.S. every year and killing over 30,000, usually without symptoms. Doctors have as screening tools a simple blood test known as the PSA and the prostate examination. But this year, the U.S. Preventive Services Task Force has called the PSA into question, saying that it leads to too many biopsies unnecessarily and too much surgery. Not all doctors agree.
We are catching them earlier, we're treating them more effectively. As a result, we've seen a reduction in about 40% in death.
Dr. David Samadi is a world expert in robotic prostate cancer surgery at Mount Sinai Hospital in New York City. Dr. Samadi has developed his own technique for using the robot's arms to pinpoint the prostate and remove the cancer. He calls September a critical month for men and warns that he's seeing prostate cancer showing up in men as early as their 40s.
African Americans need to be really aware of this 3-to-1 ratio. If you have family history, if the first generation has prostate cancer, you're at risk. For those men, I would get a baseline PSA at the age of 40, and then once a year I would follow them. If you don't have high risk, then I would start at the age of 45.
In New York City, Dr. Siegel, Fox News.